Today, I invited Miss Caroline Heward to join me to discuss mental health promotion. Caroline is a very experienced clinical psychologist. She is also known for her involvement in mental health promotion. For example, she recorded a podcast with U.S. Center for Development Psychology for their podcast, Practical for Your Purpose. She was invited by the U.S. Center for Development Psychology to present a 75-minute webinar as part of their CBD Presents webinar series in November 2025. This presentation is titled Military Identity in Clinical Practice, Enhancing Case Conceptualization and Treatment. She was also approached by the Department of Veteran Affairs Women's Health Strategy Team, that's the Australian one, to provide input and facilitate a discussion with women veterans related to their military identity. She recorded podcast for the Strength Within podcast series and invited to present in August 2025 to Townsville ADF Mental Health and GPT. And this presentation was on operating the military identity model developed from her PhD study for use in mental health and primary care. Thank you for sitting down with me today, Caroline. To start, could you please introduce yourself and tell us a little bit about your clinical work, such as who you typically work with and what your day-to-day practice looks like.
Thank you for that, Wendy. So, yes, I guess I am now predominantly employed by James Cook University as a senior lecturer, so within our clinical psychology program. Clinically, though, the vast majority of my work has been with the Defence Force here in Australia. Always as a civilian, I think that's always important that I acknowledge. I have been a clinical psychologist working on base, but also working off base in private practice and working for the Trauma Recovery Centre. So predominantly, again, seeing current serving and ex-serving members who have, for example, post-traumatic stress disorder and are accessing care through what was then the Mater Wellness Centre. So from a day-to-day perspective, the vast majority of my work, as I said, was probably working with individual members, so current serving or ex-serving members. But the reasons that they would seek psychological care were many and varied. And certainly I wouldn't want to indicate that the only reason that a defence member would seek treatment would be due to trauma, because that is not the case. Members certainly have a myriad of experiences. So I do less direct clinical work these days than I did previously. But I bring, I guess, what I've learned through the various roles I've filled now into training our future clinicians.
So would you say that your work and training is mainly focused on individual assessment and therapy?
I would say that the training that I've received, that initially, absolutely, I think psychology historically, and perhaps even to this date, does focus to an extent on the individual and on what the individual's treatment needs might be. So as a clinical psychologist, that tends to be where we are. However, what I would say is through the roles that I have had the opportunity to fill, as many psychologists do, moving beyond the individual and not just being about the individual assessment or the individual's therapy has been a really important component, whether that being looking at the broader systems within which individuals exist, so their family systems, their work systems, the society, the community, their culture, etc. Or whether that also be from the perspective of, and I know an area that we're obviously talking about today from a mental health promotion perspective, is that appreciation and recognition that psychology obviously provides a wonderful opportunity to be doing work in that early intervention or in that prevention space that traditionally we don't always think of psychology in that area. But I think that that's a very important one and an area I have had the opportunity to do some work with.
And thank you so much. And from what you said, it seems that the ideas like mental health prevention and promotion uh, are quite aligned with your experience of practice. So I would, of course, you have been involved lots of activities. For example, in my introduction, could you please tell us about what you have been involved, for example, involved with the US Department of Psychology and also our ADF, Australians ADF, etc.
Yeah, absolutely. So, as I said, the majority of my clinical work has been working alongside the Defence Force. There's been a number of roles that I've filled across the last sort of 15 years or so, and they include things like, for a period, working as the alcohol, tobacco, and other drugs coordinator within the Defence Force, within our northern region. And so that role certainly had not just an immediate assessment and intervention with the individual, but it also had an awful lot of promotional role within that. So that might be running psychoeducation campaigns, ensuring that there is information and brief interventions available. So early interventions where, say, for example, alcohol use might not be at a diagnostic level, but it's causing problems for individuals. And so there would be the opportunity to then run some small group programs that we did that really are about intervening at that earlier stage. So someone doesn't have an alcohol use disorder, for example, but their use of alcohol may be causing problems for themselves, for their families, but also for their employment. And so that's one of the areas. But I guess working within the Defence Force, within that regional team, there were a number of opportunities to work in that sort of health promotion space. So ensuring that information regarding mental well-being is available and present. Something that I'm sure you're quite aware of, Wendy, and appreciative of, is that there is a large volume of stigma attached to mental ill health. That does exist, sadly, within the Australian populace, but certainly within the Defence Force. That stigma is still there, and stigma around seeking help is also still there. And so a lot of the health promotion work is around, it not being weak to seek help, around it being, I guess, looking out for your mates, that sort of thing. So really drawing upon some of the key values within the Defence Force, so mateship, for example, and just recognizing the importance of looking out for one another. So things that are really important as a soldier, sailor, aviator, but also that when we think about our own mental well-being and the well-being of our friends, looking out for your mate is something that's really important. So certainly from a clinical perspective, there was that opportunity. And then more recently with the research that I've been doing, as you were flagging, I was invited by the US Center for Deployment Psychology to be first on their podcast. And that was really around how we can utilize research that we're doing that helps us to understand identity, in this case within the Defence Forces, within the military, how we can take that information and how we might be able to utilize that to both enhance well-being, but also coming back to, I suppose, to the individual, is in that individual space, is intervening where identity might be impacted through service, loss of service, and disruptions that can happen whilst individuals are serving.
Thank you so much. You have done a lot. For example, the small group intervention and also stigma reduction. One of the priority areas in population mental health is the mental health stigma reduction. So I really like you say it's not weak to seek help. We often say
Mm-hmm.
it's okay to seek help, but it's very relevant for veterans if we change it to it's not weak to seek help because they were trained to be strong, to fight in the battlefield. So they may often feel that it's their weakness if they need to seek help. So I like it. And in your view, of course, you already mentioned that, but I would like you to emphasize again, in your view, why is mental health promotion important for clinical psychologists?
I think the reality is that there's always going to be a shortage of clinicians who, on a one-on-one basis, can work with clients. And also, I guess we shouldn't be putting our focus, in my opinion, at that end. We should be seeing if we can prevent the development of mental health conditions in the first instance. So just as when we think about physical health, we're always looking at what are the strategies that humans can adopt and utilize that can, as best as possible, prevent physical ill health. From that perspective, that's where it's so very important that we're considering health from a holistic perspective. And so in that regard, the importance of mental health promotion and what it can do to actually bolster what am I trying to say? Mental well-being. That when we think about health from a much more holistic perspective, mental health, we should absolutely be considering about what can be done to prevent, what can be done to enhance humans' natural resilience so that that well-being can continue to, I guess, foster and grow. There will, of course, always be the need, sadly, perhaps, for intervention at the one-on-one level. But if that's the only space that we're thinking about mental health and where we can make a difference, sadly, we hit bottlenecks and we've got long wait periods. We don't have enough clinicians. We don't probably have enough government funding to actually ensure that everyone can also access care. And so that's why it's so very important, I guess, from my perspective, that we put that focus into prevention, promotion, and talking about mental well-being a lot more than we perhaps do.
Thank you so much. That's very good points. Yeah, because in the past we often think about for psychology, clinical psychologists, they sit in a consultation room to provide treatment, just like our GPs. So I very much appreciate your point of views about health promotion that is important for clinical psychologists as well.
Mhm.
So, what do you think needs to change for clinicians and mental health systems to place more emphasis on prevention, mental health prevention, and mental health promotion, not just treatment? Let's look at the training first.
I think, well, from a training perspective, what we need to consider is that, of course, within psychology, what we understand about human behavior is so much more than disorder alone. And so I think as psychologists, as trainees in psychology, that's something we already do quite well. Where there would be benefit would certainly be having a much greater probably interdisciplinary engagement when we talk about mental health promotion. And so thinking about what our colleagues in other health disciplines within both our college, but broader across the university, getting some of their perspective as well, so that we don't silo that psychologists are about, mental health, because we're not. We're about a lot more than that. But also our other discipline colleagues could add a lot into that. So I do think making a priority the discussion of what mental well-being, what mental health actually looks like, what that means, and where some of the areas that we know the research tells us humans are quite vulnerable. So, one area that comes to mind is really around loneliness, that there was an awful lot of research that probably escalated during the COVID and post-COVID period. But that's a space that we absolutely know that mental ill health can result. And so there are things that can be done and areas that we should be, as psychology trainees, understanding and studying a lot more. So I do think that in that training area, we do well, but thinking more broadly about actually what does mental health look like? What does mental well-being look like? And not just what does mental ill health or the pathologizing. That's an area where I think we run the risk of narrowing too much and missing the much broader human experience.
So the uh, positive mental health, good mental health instead of mental ill health. That's important. That's a very good point. And what about the service, mental health service models? We have lots of models. So if we would like to place more emphasis on mental health prevention, mental health promotion, so what kind of changes are needed for service models?
Yeah, I think this is the area we always hit up against is because of our electoral cycles that often from a health perspective, from politicians actually funding programs, etc., if they're things that don't appear to be able to deliver within that electoral cycle, they're less likely to get funded. And so it's wonderful that within this country we do have access to Medicare and the like, that we do have access to a number of funded sessions under Medicare. But what isn't well funded is the preventative programs. That's an area that really, I think, from a political perspective, we need a lot more focus on. But the lobbying isn't always around prevention. It's often around where it feels as if there can be more action. So funding 10 sessions with a psychologist each year, for example, that's something where there's a sense that here's a political, deliverable that we can say we're doing. Whereas actually identifying what are the programs that we need and how do we fund those when they're not going to necessarily deliver outcomes in the short term, that's a problem where unless there's a bipartisan buy-in into that space, sadly, I think we continue to get stuck in this cycle where it's about addressing the problem after it already exists rather than how do we prevent it in the first place. So yeah, Wendy, I think that that's an area that there actually does need to be a lot more lobbying. I think as people who are trained in psychology, we need to recognize that we actually have good advocacy power in that space. So that includes engaging with our local politicians, sending letters, etc., contacting the Minister for Health. It's about what we can also do as citizen consumers, and who have got training in psychology, why we should be advocating for more programs that are preventative in nature rather than waiting until we see a mental health condition and then accessing that care.
I absolutely agree with you, Caroline, about the policy lobbying. And so my next question is, for example, what are the funding priorities you would recommend related to mental
Mm.
health promotion, mental health early preventions?
I think the difficulty in that question is it feels like there is just so much that I would be advocating for as a priority. I guess though it is looking at where the greatest impacts are that we know on those individuals, I suppose, who are in more vulnerable positions. So I think First Nations health is absolutely an area that we must continue to have priority. But I acknowledge that I am, a white woman sitting here saying that. And the problem for too long has been when it comes to First Nations health and First Nations well-being is too often it's white people telling them what they need. So I absolutely recognize that that is an area that we need to see much greater funding for starters, but a much greater community engagement rather than continued, yes, the white people basically saying this is what should happen. Other areas where there's definite vulnerability are, though, and I think from JCU's perspective, this is very important for us being a place-based university, is for those in regional, rural, and remote areas. And so the elements around loneliness, which I touched on before, can absolutely come into play in these sorts of areas, but it's more than that. It's access to broader services, And so I think, the difficult thing is that there's so many areas where I think there needs to be priority. And I appreciate that that's really never going to be delivered on. But it is recognizing where our more vulnerable groups lie and perhaps prioritizing that. But more globally, it's approaching mental well-being as something that should be considered in a preventative space in the same way that we engage with, well, we know exercise is good for our mental health as well as physical health, our diets, all of these things that we engage in from a preventative physical health perspective, expanding that to then our mental well-being, but recognizing where those barriers exist, particularly for more vulnerable groups, that it's not just a matter of psychoeducation. We also have to look at where the barriers exist and look to try to reduce those. But unfortunately, yeah, I don't think I have the answer. I just have lots of areas where I do think we need to direct more attention.
And thank you so much. Yeah, absolutely. There are lots of priority areas, but you pointed out the First Nation mental health and also mental health in regional and rural and remote areas. I absolutely agree with you. So now it comes to the end of the interview. I would like to ask, for example, if you can give students one takeaway message about thinking beyond individual therapy towards population mental health, what would the one take home message would be?
Hmm, that's a great question. I guess I think that the issue is that if we focus too much on that individual therapy, we're way too reductionist in our thinking. We're trying to reduce a human down to a whether it be a disease process or a pathology. And I guess that my concern is that that is limiting. So whilst I will maintain we do need more clinical psychologists to come through and be delivering that one-on-one therapy. But if, as a part of that, we aren't thinking from a more holistic and broader health prevention, health promotion perspective, then the risk is that we are too narrow. And that's where I think we don't do our best work. We do our best work when we recognize that psychology can offer so much more than just that, as you say, one-on-one in a consulting room. We offer so much more when we appreciate what contributes to good mental health, to positive mental well-being, and take further action, I guess, to enhance that. I don't think we'll ever put ourselves out of a job. However, uh, the optimist in me, though, is that psychology can do an awful lot more in that preventative space than solely approaching it as a pathology that needs to be fixed.
So psychologists can do a lot more. So this is the message you give to our students to take home. Thank you so much. I'm sure, yeah, my students will get benefits from your talk. And also the talk will promote them to think about how to move beyond individual therapy towards population mental health. Thank you so much.
Not a problem.